I'm Dr. Jo Henderson. I am Executive Director of Youth Wellness Hubs Ontario and Senior Scientist at CAMH, as well as Director of the Margaret and Wallace McCain Center for Child, Youth, and Family Mental Health at CAMH. With me today, I've got a very exciting panel of people here with me today. The Honorable Carolyn Bennett, since being appointed the Minister of Mental Health and Addictions in October 2021, Minister Bennett has been incredibly supportive in the mental health and addictions research space. We're very delighted to have you here today. Next to Minister Bennett is the Honorable Michael Tibollo, Associate Minister of Mental Health and Addictions here in Ontario. And since 2019, Minister Tibollo has made youth mental health and substance use a priority in the province. And we're very happy to have you here today as well. Next to Minister Tibollo is Devin Wolpole. They're of Mohawk descent, born and raised in Fort Erie. They're currently in school in Mental Health and Addiction Worker Training Program at the First Nations Technical Institute. And we have been extremely fortunate to have Devin as part of Youth Wellness Hubs Ontario Provincial Indigenous Youth and Family Advisory Circle. Devin has also served on the Waihu Digital Advisory Group and is connected to Waihu Niagara. And on this side, we have Kester Phillips, who is connected to the place we are today, which is the West Toronto Youth Wellness Hubs Ontario site, and is also the Vice President of Strive Toronto, a nonprofit organization focused on Black youth. Last but not least, we have Dr. Sam Weiss, Scientific Director of the CIHR Institute of Neurosciences, Mental Health and Addiction, and Professor in the Department of Cell Biology and Anatomy, the Hotchkiss Brain Institute, University of Calgary. Thank you everyone for joining us today. I think this full room speaks to the importance of what we're discussing today. There has never been a time like today in youth mental health. A time of both critical need, but also extraordinary collaboration. And most importantly, shared vision. Imagine a world where all youth in Canada have easy and timely access to a wide range of developmentally appropriate and culturally centered mental health and social services, integrated and offered together in youth's communities, places and services that have been co-designed by young people. That's the goal of integrated youth services, to ensure that every youth in Canada who needs support is provided with the right care in the right place at the right time. Integrated youth services is a pan-Canadian and international movement that aims to build effective youth-focused health systems and service delivery models that address mental health, substance use, and other related concerns for youth aged 12 to 25. IYS, as we like to call it, addresses gaps in youth health systems by removing access barriers, emphasizing intervention and evaluation, enhancing accountability to, most importantly, accountability to youth and their families and their communities, by valuing their experiences, emphasizing equity, and focusing on integrated holistic care. But Kester, that's enough from me. I'd like to turn it over to you so that you can tell us a little bit about what the West Toronto Hub means to you, what services like this can do in the context of you and your work.
Testing. My mic is on. Sorry, can everyone hear me? So I guess being a part of the hub has been a great deal to me, and dating back to 2015, I've been part of the Supporting Young Families program. Can you stop? Me myself as a single father for many years, and then from then I moved forward to finding a love for community work, and I teamed up with a group of friends and we started Strive Toronto. from then, the hubs allowed us to foster relationships and also connect us to resources to help develop our skills, connect us to other organizations to help develop our skills, and connect us to grants and also to fund and also build relationships with the community. So I'm happy to be a part of this community as well, be a participant of this hub for the last 7 to 8 years. But yeah.
Thank you very much, Custer. It's really fantastic. And I know, Minister Bennett, you find it very inspiring to hear from youth leaders. I'd like to invite you now to come and share your comments.
Thank you, everyone, and particularly, to hear from you, Kester, this morning, and because it really is about listening to you and your experience. I don't think people think of a single father as being something that a traditional youth center would be looking to support, and I am just so grateful for your leadership and guidance. Really, I think this is really what IYS is about, and why we're so proud of Nothing About Us Without Us, the ability to make sure that the way this is co-designed is listening to people like you and your friends, and being able to tell us, have our finger on the pulse of really what's going on. I know yesterday, meeting with my youth council, they just show you a different way of looking at things that is just so important. And I know they used to say to me, in the midst of COVID, they didn't want to build back better. They didn't want to go back to anything. They wanted to leap forward into something that was more equitable, more just, more green. And I think that it is that, as the Prime Minister says, that you're not the leaders of the future, you're our conscience right now as to what's working and what isn't working. You're the leaders right now today. And so I think that as we listen properly to youth, and we know right away that we have to make sure they know they're not alone. That's what IYS does. That whether it's anxiety or depression or just juggling too many things, that or even worrying about their substance use or the substance use of a friend, we have to make sure, as Joe said, that they are receiving the most appropriate care in the most appropriate place by the most appropriate provider at the most appropriate time. And I think why we all love why we're here today is determining appropriateness is two things. It's the evidence, but it's also listening to the lived experience of those receiving the care. And so we have to have both things. And that's what integrated youth services means to me. C'est formidable d'être ici au West Toronto Youth Wellness Hub pour voir les installations et témoigner de soutien incroyable qu'elle apporte aux jeunes de la région depuis 2010. Je tiens également à reconnaître que le territoire sur lequel Wellness Hub fonctionne, je tiens à souligner que nous sommes sur le territoire traditionnel des Mississaugas of the Credit. J'aimerais rendre hommage aux peuples autochtones qui ont pagayé ces eaux et dans les mocassins ont foulé cette terre. It is, as I was coming up and thinking, the Minister Hussein couldn't be here. This is his riding, but he would have loved to be here, in that everything that he does is about that bottom-up support, and whether it's, and even last week I was asked a question of how does housing fit in to everything we're doing, and it is, it is so important that we end up with this whole of government approach to the kinds of supports and services and vision that people have, but also it is through the, not only all government departments, but all jurisdictions are playing a role. And that's why it's so important to have Minister Tibollo here with your leadership and your focus on research and data. So this is really very exciting. It is, it's not hard to be a fan of integrated youth services. I have to say that one of my friends, Nora Spinks, used to always say, what would it look like if? And I think that's really what what Joe just said, that what would it look like if kids got what they needed when they needed it, and in a way that they could feel they were part of the designing it. And so it is so exciting to actually be part of the kinds of leadership that we've seen coast to coast to coast, and for us to acknowledge Chris Musquash in Thunder Bay, obviously Dr. Steve Mathias from Foundry in BC, Joe Henderson, of course, Dr. Iyer, and the formidable Sam Weiss from CIHR. It is dans tous les pays des communautés aident déjà les jeunes par le biais des services intégrés pour la jeunesse, et plusieurs pionniers s'efforcent de faire en sorte que les jeunes aient accès à des services de soutien en matière de santé mentale et de dépendance. It is also with Joe and as the liaison, they acknowledge the huge collaboration with the Center for Addiction and Mental Health, playing such a key role in the plan to collect the data across all of the provincial IYS and territorial IYS networks to establish the sort of common measures, evaluation frameworks, governance, and the digital platform. It is, I think, groundbreaking that all provinces and territories, all 13 jurisdictions have established IYS sites or are currently in the process of doing so. There's approximately already 65 sites that are established across the country, with dozens more currently in the planning phase. And now it's time to connect these sites together in terms of learning from one another that bring the diverse services and perspectives from youth and care providers, partners, researchers, and of course, people with lived and living experience. This is what is so exciting, is that there are the wise and promising practices, the ability for people to steal good ideas from one another, to try this, or as I think Minister Tibollo and I feel, for us to share something that seemed like a good idea but didn't work, and that the kids hated it. And so, what we actually have to be clear about what a learning system looks like, and it means you try stuff and you listen hard and try again, and that is that measure, adapt, which makes for learning systems, complex adaptive systems. This is what we have to do. And I must say, as some of you have heard, a lot of my friends, my friend, Dr. Karen Brake, who was the pilot or the physician for the snowbirds, used to say, why don't we have this for veterans? Like, why don't we have, what would it look like if really Canadians coast to coast to coast could avail themselves of truly integrated services that actually were part of determining the appropriateness of the care and the appropriateness of the provider. So it was, I think, as Hope Minister Tibollo agrees, that at the health ministers meeting this month, I think that one of the main things that we talked about in our our segment on mental health and substance use after lunch was integrated youth services. It was something that everyone is excited about and a priority across the country. The willingness to continue to work to make this accessible for all Canadians, and to go and visit the hub, the foundry at Vancouver Granville with Dr. Mathias, and hear from that amazing young woman who, you know, as a refugee had, with the help of the foundry, had really got her life straightened around in sort of 5 months, and was now the spokesperson for that. It was extraordinary. And I think that, and then the next day where we got to meet with a lot of the pionniers, the pioneers in this, in all 13 jurisdictions were represented at the meeting with Sam and Dr. Mathias, and it was, I think, just to inspire. I only got to be there at the beginning of the meeting, but I'm certainly hearing that it went extraordinarily well. Il est clair que nous disposons des personnes de l'élan nécessaire pour connecter tous ces réseaux afin de poursuivre l'expansion du mouvement SIJ. It is, again, I think all of us as ministers want to be funding what works and be able to move money on things that aren't working to things that are working. And I think that is really why this Learning Health Network of IYS is so exciting. And it's certainly something that we have seen and have evidence is working. So today, we are now committing over $18 million to support integrated youth services across Canada. Maybe there should have been a drum roll. Yeah. And as part of this investment, the Canadian Institute of Health Research is investing $1 million to establish this pan-Canadian integrated youth service network of networks, IYS Net. And 3 of the most established provincial networks for IYS will receive this initial funding: Foundry in British Columbia, Youth Wellness Hubs in Ontario, and Verte in Quebec, as well as the Indigenous network with Dr. Musquash drawn from Access Open Minds. The next step for IYS Net is a $15+ million research funding opportunity co-founded by CIHR and Philanthropy, which will expand the network, bring existing and new provincial and territorial IYS networks into IYS Net. Grâce à cette expansion, nous améliorons l'accès aux services et au soutien en matière de santé mentale et de dépendance en faisant progresser la recherche, la collaboration et la mobilisation des connaissances à l'échelle du Canada. Health Canada is also, and the Associate Deputy Minister Eric Belair there, he has a lot of the money. He and his department are putting nearly $2 million in funding to the Center for Addiction and Mental Health to support the IYS improved understanding of the youth services needs and outcomes. It is only by working with organizations with a shared vision and common goals that we are multiplying our efforts to support the health and well-being of all young people in Canada. It is indeed bottom up. So today is an important day. IYS are core examples of how and when we work together across the country, we can support Canadians and lift them up. We're not only connecting the networks together, but laying down the infrastructure for future growth. And then with the data collection that each IYS will be doing and then sharing, we will be able to have informed wise practices as we move into the next phases of the development of this nationwide network. Je voudrais prendre un moment pour remercier tout le monde d'être ici aujourd'hui et particulièrement pour les jeunes qui nous avons avec nous et qui partagent courageusement leur histoire. As Minister of Mental Health and Addictions, supporting the mental health of Canadians, expanding the delivery of high quality, accessible and free mental health services, and creating national mental health service standards is our top priority. I am so happy to be working closely with all of you here today to achieve this. Thank you. Merci. Miigwech.
Thank you. Thank you, Minister, for those exciting announcements. It is a spectacular day for young people in Canada, and those kinds of announcements are the kinds of announcements that will create transformative change in terms of achieving optimal outcomes for all young people in Canada. Devin, I'd like to turn it over to you now. You've had many connections with Youth Wellness Hubs Ontario, at the community level, also at the provincial level. And it's been a privilege to hear you sort of talk about what this has meant to you. I'm wondering if you could share some of your thoughts with us today.
Is it working? Okay. So for me, this is such a big, this is just huge. The fact that now we're getting the funding for all provinces to kind of have this IYS net, and for me to be able to connect with youth across all provinces is such a big thing. I originally came to Youth Wellness Hubs Ontario 3.5 years ago after having a crisis and ending up in the emergency, the psychiatric emergency room. And there was actually a worker from one of the local hubs in Niagara there with one of her clients, and I talked to her and she says, hey, we have this hub in Fort Erie, you should come check it out. And it's at the Fort Erie Native Friendship Center, and being part Mohawk, I had never really been there before, but so I ended up going to this hub site, and it was like the biggest welcome home. Like, it just felt like home to me. Being welcomed and having services that I was so easily able to access has brought me to this point. I'm sitting here next to two ministers of mental health and addictions. And so this is just such a big thing, and I'm hoping other youth will be able to have the chance to be here one day. So thank you.
Thank you, Devin. We really appreciate all that you've done for young people. Now I'd like to turn it over to Minister Tibollo, who has been such a huge supporter of youth in this province.
Thank you, Dr. Henderson, and thank you everyone for joining us today. Minister Bennett, it's always a pleasure to be with you and to share a lot of our common ideas, and that's one of the things with the Youth Wellness Hubs that I can say has been really a good effort on behalf of the federal government and our province in Ontario. You know, today, this morning, we had the opportunity, and I listened to some of the people and the excitement when it comes to the discussions around this groundbreaking initiative. To all their panelists, I want to tell the panelists that were here today, to all the people that were on the online as well, I want to say thank you for making this a priority. Our kids really are the most important people in our society. And when you think about the amount of mental health issues that become prevalent in adulthood, if they were dealt with properly in youth, we wouldn't have as many issues as we have. And this is an amazing initiative, and to have youth present today as well to share their excitement. And I've had the opportunity now to visit many of the youth wellness hubs in the province of Ontario, and I'm really happy with what I'm seeing. At this point, we've opened 22 youth wellness hubs in the province of Ontario. 8 are presently in development and will open, I'm hoping, Doctor, by the end of this year. One of them that I'm really proud of is one that it's a collaborative in Sagamok, one of the Indigenous First Nations communities in the north that will be Indigenous-led and will certainly be incredibly important. You know, when you think about the issues that affect our youth, stress, anxiety, depression, all of these issues are not only faced by the youth, and not only in the province of Ontario, but all of Canada. And what we need to do is we need to start looking on a national basis, not just provincially, as to what we're doing. We always talk in government about silos. Well, those silos need to be broken within the province, between provinces, and we need to collaborate. You know, COVID-19 has been a really difficult situation for all of us, no matter where we are in Canada. Our systems were all pushed to the limits. And one of the things we discovered is that there are things that we can do, and there are things that we must do to protect the most vulnerable in our society. And I would say today that our youth are some of the most vulnerable people in our society. And we need to be innovative, and we need to collaborate. And I think that's what we're seeing with the integrated youth wellness services. You know, this is something that started pre-pandemic, but we realized that we needed to find ways to lower barriers to provide better supports in a safe, a culturally safe space for our youth that would give us the best results. And we're seeing them in Ontario. I can tell you in Wellington alone, where we have 4 youth wellness hubs, over 16,000 youth have used the facilities and have been part of the work that's going on there. So clearly there is a need, and clearly there is acceptance, because it's created by the youth for the youth and is making a difference in their lives. In Ontario, as I said, we really work hard to build those collaboratives, not only between the youth wellness hubs themselves, but also to ensure that we have a continuum of care that allows a soft handoff of that individual to get other supports that are needed. And I really believe, and I've shared this with Dr. Henderson, and I think with Minister Bennett as well, not only are the youth wellness hubs the beginning of something, but they're going to provide us opportunities to expand services in ways that we haven't even thought of yet, because they're going to develop and they're going to be tested, and they will pivot to the direction that they need to go. And that's what we need to have, is a learning healthcare system. And this is amazing news that we're doing it, especially starting with the children and youth. And just to conclude, I do want to say that this net, the information, Minister Bennett and I have had many conversations, and Dr. Henderson as well, about data. You know, you can't manage if you can't measure what you're doing, and making investments without knowing what is the best approach to do something and measuring the outcome, you're always going to be a hit and miss. You're never going to know whether you've made it or you're not going to make it. So this gives us the opportunity, measuring, and to be able to plan and to ensure that we're doing the best for our children and youth. This announcement today, I think, is extremely important. It proves that collaboration is possible, not only between governments, but also between provinces and territories. And that is extremely important to us, because we need to build an equitable, accessible, and evidence-based mental health care system for our children and youth to ensure that they have the best opportunities possible. Thank you very much. Thank you so much for this as well.
Well, we're nearing the end. We heard, thank you, Minister Tibollo, for your comments, your emphasis on the importance of data and measurement, and really our accountabilities to young people. And it's made possible, Minister Bennett, by, under your direction, some of these federal investments as well in data infrastructure and research. So I'd like to turn it over now to Dr. Weiss from CIHR to say some closing comments just before I wrap up.
Thanks, Joe. I'm just super thrilled to be here today. I can't begin to express how exciting it is to see the Government of Canada, Indigenous communities in 13 provinces and territories coming together to create Canada's first ever learning health system for youth, mental health, and substance use health. I couldn't leave today without acknowledging our colleagues in the philanthropic community who've been enormously supportive. Ian, the Graham Beck Foundation, the role that it's played, both in terms of funding, but also reaching out to every province and territory and demonstrating the value of integrated youth services. Amazing. Thank you. I know that Bell and RBC have been collaborating effectively now as well with Ian and the foundation, and it's just exponentially enhancing the capacity that we're talking about today. It's amazing. Hard to believe that it all started a little over 10 years ago, and now each province and territory is able to create its own network, its own backbone, and then reach out to each other province and territory and say, work with me. Our youth want to work with other youth. We all want to be closely connected. It's an unbelievable sense when I listen to Devin and Kester talk about how their lives were transformed, and the young woman who came from Saudi Arabia who had to she had to escape discrimination, both as a woman, as a member of the LGBTQ community, but she came to Canada, and she was not just rescued by our country, but she was rescued by Foundry that took her in and gave her purpose. She spoke about purpose in a way that really made your heart soar. And I'm hoping that when we talk about no single youth will ever be left without services, we'll always think back to this young woman who told us about her story coming here from Saudi Arabia. The youth drive this. The youth are not just, as Minister Tibollo said, not just the future, they're our current conscience, both about perhaps some of the mistakes of the past, but some of the solutions for the future. And the youth are gonna both ground us on this and help propel us to a much better future. So it's a glimmer of light that I think is incredibly bright when youth, families, decision makers, researchers, providers, policymakers, and policy leaders tell us that together we're going to transform the future. We're going to a new place where youth will determine their own future. And I thank all of you for being part of it. Thank you.
Thank you very much, Sam. And I want to thank Kester and Devin, Minister Tibollo, Minister Bennett, everyone who joined us virtually, and all of you in the room. Thank you so much for being here today. It's a very exciting day for young people. We're going to open it up now for questions from the media. Haley, Zach, I'll let you facilitate.
Hi, everybody. Yeah, like Joe just mentioned, we will open the space up to questions from the media. Is anyone on the Zoom call, who would like to ask a question, or anyone in the room? No, I think we are good. So thank you, everyone, for coming today. Thank you to the venue for hosting us and for our speakers.
Yes. Okay, without any questions then, I would like to take a moment to thank David O'Brien and Neely and the rest of the team from West Toronto Youth Wellness Hub who hosted us today. I'd like to also thank the Youth Wellness Hub's Ontario provincial team and all the folks from CAMH, the minister's offices, everyone who helped bring this together today. And thank you to all of you who took time out of your day to be part of this really special event. So thank you very much.